Throughout the pandemic, so many of us have helped our neighbors, such as giving a ride to vaccine appointments or knocking on the door to get some human connection when we were cooped up at home. But a group of doctors went above and beyond when their colleagues and patients needed them the most. News for Tucson's Eric Fink explains.
Good morning, Destiny. During our winter surge, when our COVID numbers were rising every day and hospital capacity nearly at a breaking point, one anesthesiologist at TMC stepped up and stepped in to the ICU.
Some sadness, I think, is probably the biggest emotion because these patients are very sick, extremely sick.
Heidi Tavel was born and raised in Tucson. This physician anesthesiologist at TMC answered the call when her hometown and her hospital needed her compassion, her care, and her expertise. She and some of her colleagues left the operating room for the ICU last Christmas to take care of COVID patients.
I think when we were first asked and I first volunteered, our overwhelming sense was a sense of duty. I'm born and raised in Tucson, Arizona. There are sick and dying patients in Tucson. They need my help.
More than 3 months after Tavel's first shift in the ICU, Pima County reported 85 new coronavirus cases Tuesday, but doctors say we must stay alert to avoid another spike.
We need to buckle down and keep doing this for another 6-7 weeks, especially with the additional vaccine coming in from FEMA. We'll be able to get through this and then relax all of the mitigation efforts pretty soon, but we have to wait. We don't want to force another surge.
Tavel says this once-in-a-century public health crisis has only reinforced her career choice. For her, this is a calling.
This is exactly why I went into medicine. This is why I went to medical school. This is why I put my life on hold and went through 12 years of education and student loans and everything else, because when people need us and are sick and dying, we're here, we're physicians. That is our main duty. My number one job is physician. My second job is physician anesthesiologist.
And as unpredictable as this virus is, Tavel says if there's another surge and the hospital calls, she'll be there in the ICU on the front lines for her community. We're live in studio this morning. I'm Eric Fink, News 4 Tucson.